What is Nexplanon? Nexplanon is a hormone-released birth control implant for use by women to prevent pregnancy for up to 3 years. It is a soft, flexible rod about the size of a matchstick that is inserted under the skin of a woman's upper arm. Nexplanon is a long-term contraception method and is over 99% effective at preventing pregnancy. How does it work? Nexplanon contains an active progestin hormone which is released continuously into the bloodstream from the implant. This hormone prevents ovulation. It also thins out the uterine lining and increases the thickness of the mucus in the cervix, making it more difficult for sperm to cross from the vagina into the womb. The implant must be changed every 3 years. How effective is it? Nexplanon, when inserted correctly, is over 99% effective. Certain medications, however, make it less effective. It is recommended to use an additional contraception while on these medications. Nexplanon does not protect against sexually transmitted infections, including HIV. How do I use Nexplanon? Your doctor will insert and/or remove Nexplanon in a minor surgical procedure here in the office. It will be inserted just under the skin on the inner side of your upper arm. The timing of the insertion is important. Depending on your history, the doctor may ask you to have a pregnancy test done before insertion and/or schedule the procedure at a specific time. Nexplanon is placed just underneath the skin using a small needle introducer with the use of a numbing agent. Are there any side effects? The most common side effect of Nexplanon is a change in your normal bleeding pattern. Other common side effects include mood swings, weight gain, headache, depression, acne, vaginitis, breast pain, and pain at the site of insertion. What are the possible risks? Women have experienced complications with insertion and removal of Nexplanon. Though rare, it may not be inserted at all due to a failed insertion or if the implant has fallen out of the needle. If this happens, you may become pregnant. After insertion, you should be able to feel the implant underneath your skin. If you can't feel it, tell your doctor immediately. Other problems related to insertion include pain, irritation, swelling or bruising, scarring, or infection. Very rarely, Nexplanon may break, making it very difficult to remove. For more information or to schedule an appointment for a consultation, please call Professional Gynecological Services today and speak with one of our knowledgeable staff members.